How do Medicaid spend-down rules affect applying? Imagine needing long-term care or extra medical help, but your income or savings are just a bit too high to qualify for Medicaid. What do? That's where spend-down rules come into play. They can seem complicated at first, but understanding them can really help you access the benefits you need. Medicaid spend-down rules let people who have income or assets above the limits still qualify for Medicaid by paying some of that excess money toward medical costs. Think of it as a way to spend down your extra funds on approved healthcare expenses before Medicaid kicks in. This process is especially important for seniors applying for Medicaid, particularly if they need long-term care or are dual eligible with Medicare. Here's how it works with income. If a senior's monthly income is higher than the state's Medicaid limit, they can qualify by paying the difference on medical bills, prescriptions, health insurance premiums, or other approved healthcare costs. For example, if the income limit is $2,000 a month and the person earns $2,000 to $100, they need to spend the extra $200 on medical expenses. Once they do that, Medicaid can start covering additional costs during the spend-down period, which usually lasts from 1 to 6 months. Asset spend-down is similar. Seniors must also keep their countable assets below a certain limit. If they have more than allowed, they can spend the excess on qualified expenses like medical bills or home modifications. But they must avoid gifting assets below fair market value, because that can trigger penalties and delay eligibility. This is checked through a 5-year look-back period, meaning Medicaid reviews transfers made in the past 5 years to prevent improper spend-down. Only specific expenses count toward spend-down. These include medical bills, health insurance premiums, prescriptions, nursing home care, home health aides, and necessary home modifications like wheelchair ramps. Regular household costs like rent, utilities, or groceries do not count. Applicants need to keep detailed records and receipts of all expenses used for spend-down. This documentation proves they met the requirements during the application process. Proper record-keeping is key to avoiding delays or denials. For seniors, spend-down rules open a pathway to Medicaid even if their income or assets are just above the limits. It helps those needing long-term care or extra medical support access coverage without waiting. But managing spend-down carefully is important to prevent gaps in coverage and ensure timely approval. In essence, Medicaid spend-down rules mean that seniors can qualify by reducing their income or assets through approved medical expenses. It's a process that requires planning and organization but can make a big difference in getting the care they need.